good evening to you. Thank you. So just why is it so many years later, as we discuss TB here in South Africa, we are still not on top of this issue?
Yes, I think that some of the issues are multifactorial. I think South Africa still suffers from a big TB epidemic because of the concomitant HIV epidemic, which obviously created a recrudescence of cases. And therefore, we are still struggling with trying to deal with that. As you know, there's been a lot of progress. About 60% of people who are infected with HIV are currently receiving life-saving ART, which also helps with TB prevention. But we need to do more. We need to have an approach, a comprehensive approach to TB that includes identifying the right people to prevent TB in and providing them with life-saving preventative treatments.
This all comes with quite a cost, though, and this seems to be a bit of an ongoing problem here in South Africa. There are many people who want to be on TB treatment, but these things are quite expensive for many South Africans living below a certain income bracket, isn't it?
Well, so for the TB treatment for TB disease, it's actually provided for by the government. And so if you go to a government clinic, you will receive that. I think for TB preventive treatment is also included in the conditional grants for TB within the government. However, some of the drugs that are coming out that are short term, easier to take, are relatively more expensive than your traditional sort of isoniazid, which is the one drug that is being used currently. So we obviously need to get to the point where these drugs are more affordable for everybody, especially for the governments that are supposed to roll them out. But within South Africa, usually it's within the government district clinics that these are provided.
So when you start comparing South Africa, A, to the rest of Africa, and then B, to the rest of the world, let's talk about successes. It's very easy to get caught up in the failures of TB prevention and treatment, but are there some success stories? Are we getting on top of it in some way or another?
So I think South Africa actually is doing okay. I think that it's one of the countries that has a good domestically funded TB program, so that's a success in terms of comparing to the rest of the world. It does have a very big burden, so I think that you always can do better. I think that one of the things that it has done is also being able to provide, being one of the countries that has provided the most preventative treatment to the people with HIV, and it has the biggest global HIV program in terms of ART. So I think that definitely those are successes that can be counted for South Africa.
So when it comes to dealing with many of these types of diseases and how to treat them and how to manage them in South Africa from a government perspective, government in this case may seemingly have the money. Is it implementable? Are there enough experts? Are there enough doctors? Are there enough clinics to take what government wants to do and actually transplant that into the grassroots level?
I think that that's a problem. It's a difficulty. I think that, most of the time you have nice policies and nice products that you have on paper. It gets very difficult to translate them into practice. I think that, recently for World TB Day, the Lancet Commission has prepared a report which provides countries with a roadmap on how to sort of approach TB in the countries and how to get to the point of eradicating and actually ending the TB epidemic. And I think it's important to focus on the areas where you have, and the populations where you have the highest need, and to really focus on those populations and those demographic areas to be able to provide them with the services that you need, as opposed to blanketing the whole country. So we have to be a little bit more refined so that we're also able to provide people with patient-centered care that actually involves them as the patient and make sure that they're part of the outcome, and try to get them to also be galvanized in terms of their particular outcomes.
I'm going to ask you to elaborate, Doctor, if you could. You brought it up in your response there, certain demographics in certain areas as far as TB is concerned. Are there hotspots in South Africa that people need to be aware of?
So there are hotspots, but obviously it takes a lot of time to map them out, and the idea is to do a lot more research in terms of mapping out these hotspots and understanding exactly what the transmission risks are. Obviously, TB, unfortunately, is a disease of poverty and happens when people are in closed spaces and don't have access to preventative treatment or even treatment. You have to find the right patients with TB. You have to try to put them on treatment early on so that they don't transmit to other people in their communities. And then you have to find the people who they have maybe been in contact with and provide them with preventive treatment. That's usually sort of a classic epidemic approach in terms of how we deal with epidemics. Can be difficult if you are in settings that are very highly populated.
And difficult to get to, I
Exactly.
imagine, as well. Let's not assume, and I would not like to do this for viewers watching at home at the moment. So World TB Day is what we're discussing. I don't want people to get into a panic and suddenly think I have TB because they're not feeling well. Just take us back to, almost respectfully, TB 101. You're living in an area that perhaps you know might be a high-risk area, or you know someone who you suspect might have TB. What are we looking for?
So TB generally is manifested by, it's a pulmonary disease, so it happens in the lungs. So people cough a lot. People get weight loss and they lose quite a lot of weight. They can have fevers, but obviously fevers can also be due to many other things. And then they can have what we call night sweats, which is waking up at night feeling very hot and sweaty and having soap through your clothes. I think if you have any one of those 4 symptoms, you should present yourself to a clinic where you can actually in South Africa get a very sensitive and very accurate test, which you can to determine whether you have TB or not. And I think that if you have somebody in your family who has had TB, it may be wise to go to the clinic as well, to your local neighborhood clinic, and find out if you are a candidate for preventive treatment or if they can rule out TB for you.
Final question, very brief answer, if you could, Doctor. Is there still a bit of a taboo around TB in South Africa? Do you find people, perhaps men even, are still too scared to come forward and admit that they may have TB as a bit of a taboo subject?
Definitely, and I think this is part of the whole aspect of trying to reach the right demographics, because men actually tend to have less poorer outcomes in terms of TB. It could be because of the stigma. There's a lot of stigma attached in terms of people not wanting to disclose that they have TB or they know somebody who may have TB, and that does hamper our response efforts.
I appreciate you coming in to speak to us on what is today World TB Day. If you've missed anything from that interview, our team are going to be loading that up onto the website. It's enca.com. You can also find it on YouTube as well later this evening.